welcome back. This is video 2 for lower back pain month. And last video we talked about really just the anatomy of the lower back. We described the L1, 2, 3, 4, and 5, the sacrum, the SI joint, the facet joints, the disc, and where the nerve comes out, and the sciatic nerve. Today we're going to talk about the top 3 most common types of lower back pain. Remember, I'm talking about types, not causes. The type of pain just means where the symptom is. It doesn't mean what's causing it. The first type of low back pain is called facetogenic, or mechanical low back pain. It's when these guys right here, the facets, are hitting each other at the end range of movement and the bones are slamming into each other, causing inflammation. These guys move when the spine bends side to side. They move when the spine rotates left and right, and they move when the spine flexes forward and extends back. If the spine is doing too much motion because the areas above and below are not helping out, then the facets are going to be hitting the end range. The end range of any joint over time starts to damage the joint, and it can cause inflammation. So type number 1 is mechanical or facet lower back pain. Typically it's centralized, meaning it's right in the center of your lower back. There's no pain that travels down your legs. Okay. Type number 2 is by far the most common. It's called stenosis. If we look at this from a view, if I can get the right view here, there's a hole in the spine on the side right here. This is the top segment. This is L1. This is L2. There's a hole right here. It's called the neuroforaminal hole. It's where the nerve, if I hit the nerves, see the nerve comes out of that hole right there. It has space. When somebody gets stenosis, that hole becomes smaller in diameter, okay? Because the bones are growing thicker. Now, when somebody has stenosis, it doesn't mean that they're stuck with pain. It just means that we need to identify what's making that hole becomes smaller with movement. Since the fixed diameter is smaller, there are movements that make the hole smaller and bigger. The movements that make the hole bigger are flexing forward, side bending away from that side, and rotating towards that side. Now, I can make the hole smaller by extending my back backwards, by side flexing towards that side, or by rotating away or to the opposite side makes it smaller. So that's stenosis. It's also called degenerative disc disease because when this disc gets degenerative, it narrows the space here between these two bones, which then indirectly makes this space more narrow because this space is dependent on the disc height. It's also called arthritis. So arthritis, stenosis, and degenerative disc disease are all the same thing. All right, now type number 3 of lower back pain is when we have a disc. Oh, there's the disc. Look at that. Perfect. So the disc material, you see how the disc sits really close to this hole where the nerve comes out. Now, if I have a herniated or bulging disc, that disc can push on the nerve. Okay? So type number 3 is disc bulge or herniation. That can happen at any level in the spine, and it can be something that pushes on the nerve, and then typically we get sciatic pain that travels down the leg. And finally, type number 3. Let's see if we can get down here. Type number 3. Come on. There we go. Type number 3 is the SI pain, where the sacrum meets the pelvis or the ilium. In this space right here, there's a joint. If there's too much movement in this joint, the joints rub on each other, they get inflamed, the joint gets damaged, and there's pain. Typically, it's not sciatic pain. Typically, it's pain on one side, lower in the spine, and you can put your thumb right on the spot. So those are our 4 types of low back pain. And in the next video, the final video, we're going to show you movement strategies on how to relieve stress for all 4 types of lower back pain. And it's not by moving your back more, it's by moving your hips, and it's by moving the upper spine more to take stress off of the lower back. Hope you enjoy.